Hi, I'm Felicity, registered nurse, cosmetic injector and clinic owner. Welcome to my channel, The Fit Injector. Today I have DMs of a cosmetic injector for you, part 2. Now, I feel like I have to apologize every video if there's some background noise. Baby P is here at my feet, playing around, learning to crawl today. So let's get started with question 1. Do you do dental blocks for lip filler? Now this is a yes and no answer. So the yes being, yes, I can do dental blocks for lip filler. The no part is, it is actually not my preference. Now the reasons are, the main one is, think about when you've been to the dentist, if you've had numbing to your mouth before. Not only does it make your entire mouth numb, it makes your lips so numb that you will hold your lips differently, and there is the potential for one side of your lip, sometimes even both, to actually drop. Now think about a lip filler treatment where we're trying to be really precise, we're trying to get the symmetry correct, we want your lips as perfect as we can possibly get them. If you're holding your lips quite funny or one side or the other has dropped, as injectors, we run the risk of making your lips look uneven. Then there's the fact that that is actually more needles. So I would have to inject you more times to do that, and actually injecting the local anesthetic can be quite painful as well. And also the recovery time is actually increased. So yes, I can do it, particularly for people who do request it. People who have very, very low pain tolerances and they've perhaps had the other numbing options before and it just hasn't been effective for them. But I have a really strong prescription topical numbing cream, which is so effective for 99% of people I treat for lip filler. And that combined with, actually in the filler, there is a numbing agent. So as I'm injecting your lips, that's keeping you really nice and comfortable. And also, you may have seen on some of my videos, I use tiny little needles when I am doing lip filler to keep you comfortable throughout. Question number 2 is Hyalase painful? Now, if you don't know what Hyalase is, it is hyaluronidase is the full name for it. That is the dissolving agent for hyaluronic acid fillers. So legally, as a clinic, as a registered nurse, I need to carry that medication if I needed to dissolve dermal filler really quickly if we were having an adverse event. You can also use that medication to dissolve if you've got lumps, bumps and migration. You can have a look at one of my previous videos of dissolving old migrated lip filler. Now, I feel like word on the street is it's painful, because a lot of patients who ask for the dissolving also say, oh, I've heard it's really, really painful. And my answer to that is, well, it is needles in the face, so there's always going to be some degree of discomfort when we're doing that. But pain is subjective, so everyone experiences everything a little bit different. But if you are having anti-wrinkle or you've had dermal filler, the sensation is pretty much the same. Now, using the dissolving agent is actually really quick. It's not like with our anti-wrinkle and our dermal fillers, we have to have that really careful, perfect placement of our product. It's just about actually getting the product in there, giving it a really good massage. And with this agent, it spreads really well through the tissue. So we don't actually need a whole lot of injection points. But this is actually a time where it is really good to use a dental block, particularly for people with quite a low pain tolerance, because it doesn't matter about the symmetry because we're actually dissolving the filler. Now, question 3 is, do you do a liquid rhinoplasty? And if you don't know what this is, it involves using dermal filler to the nose for symmetry, straightening, lumps, things like that. Now, from a professional standpoint, I do not offer this treatment. And you'll find a lot of injectors have that same standpoint, because doing filler to the nose and also, while we're on it, the forehead, those are the 2 highest risk areas for complications. Now, if you are a patient of mine, you know what those are because we talk about them every single time you have treatment, because this applies to any dermal filler in any area of the face, no matter how many times you've been injected or how many times that injector has injected someone, that risk is always there. It's a really, really small risk, but it is something we have to talk about. Now, that risk is where filler could enter a major blood vessel, causing a potential blockage. And if left untreated, that's where we can run into issues of tissue necrosis. And there is a risk of those blockages traveling to the back of the eye and causing blindness. So absolute worst case with dermal fillers is blindness. Now, the reason I don't do noses or foreheads is because those two areas are the highest risk for blindness, and you will find that in the research cases of vascular occlusions leading to blindness. So I choose not to put my patients at an increased risk of that. Now, obviously people want that, and I'm not saying don't have that treatment, but just be aware of those higher risks. If my patients do ask for that, I absolutely can refer you to someone who is a specialist in this area. You want to be treated by someone who's doing that and they specialize in that every single day. Question 4 is chin filler best for an orange peel chin? Now, if you try and think about pulling your chin muscle up towards your nose like this, you may see in the mirror what looks kind of like the outside of an orange. Now, if your chin muscle is really strong on assessment, I will actually recommend that we neuromodulate this first, which means we use the anti-wrinkle injections into that muscle to soften that, help to reduce that orange peel effect. And what it also does is, because our chins can get strong and kind of do this almost like a witchy chin, give it a little like dimple or a crease through the chin, by putting that anti-wrinkle injection into the chin, it actually relaxes that right down and often changes the shape of our chin. So what I like to do, if it's necessary, is do that first and then follow up 2 weeks later once that anti-wrinkle medication has taken its full effect, and then reassess for the fillers, because often I may inject a different amount to what I first thought, and I may inject it differently. And I prefer this because, especially if you have a very, very strong chin muscle and we go putting chin filler in there before we relax that muscle, we do run the risk of the filler spreading through that area, that muscle sort of pulling it in different ways, and it just not looking quite right. So that's how I like to do that, and that's why I'll be asking you to do those funny movements with your chin on our consultation. Question number 5 is your skincare made in Australia and is it tested on animals? So two sneaky questions there. Yes, it is made in Australia, actually in Sydney, where my clinic is based, very close to me. And no, of course, it is not tested on animals. Absolutely not, and I would not stand for that in a skincare range. Now, question 6 is, what have you recently had done? And the reason being, I did get quite a few comments and also messages after I posted a recent photo of myself, and I'll put it up, after I had my first lot of anti-wrinkle injections, and I also tried the new bio remodeling injections, the injectable moisturizer, and that was after a 1.5 year break from having any injectables throughout my pregnancy and also my breastfeeding. And then I got asked some questions of other things. So I'll tell you exactly what I've recently had done. That was anti-wrinkle injections to my frown, forehead and crow's feet. As I mentioned, I had the injectable moisturizer, and that was right through these sections of my face. And then over the last couple of months, I had a few questions around how my jawline was looking, and I would put that down to having 2 rounds in the last couple of months of the face shape radio frequency skin tightening treatment. I had that to my full neck and my full face, and I really feel like that's helping through my jawline. I've also had for my skin, I've had the HydraFace, which is the medical grade facial, the brand new treatment. And also, of course, lots of LEDs and of course, skincare. So it is a combination of things over the last few months leading to that, we're gonna call that mummy glow up. Thank you so much for watching this video. I hope you enjoyed those questions. There were some really great ones that have come through since I last did one of these videos. So keep them coming, and hopefully we'll have enough to do a part 3. I do really love answering these. Drop any more below. They may get added to the next video. Give me a thumbs up if you enjoyed this. Don't forget to subscribe for more, and I'll see you in the next video.